So welcome, everybody. This is our 31st Women in Medicine Breakfast. 31st. That's really an accomplishment, I think. We are very pleased today to have our topic of food insecurity. But first, I want to show you the members of my Women's Caucus. You'll notice that besides our members, we also have residents and students who are also members of Worcester District. Secondly, I want to give a big shout out and a big thank you to Physician Insurance. Physician Insurance is a program through the Massachusetts Medical Society, and for years they have been a supporter of our Women in Medicine Breakfast. In particular, I want to thank Megan Stanley, who is on the call with us today, and for her support and her continued work with us as we do these programs. We're very grateful. Thank you so much, Megan. Now, I would like to introduce our speakers. The first speaker we have is Jean McMurray. Jean is the CEO of the Worcester County Food Bank, where she has been since 1998. She has had great leadership and vision for the food bank, and we're going to hear today about all of the programs that they have available, all of the services that they provide, and I think you'll find it very interesting that may be helpful to you with your patients as to what's available through the food bank if you're not already familiar with it. So thank you, Jean. I'm not going to give a long introduction because we would be here all morning. So our next speaker is well known to everybody here and a great supporter of Worcester District and of physicians in general. And that is the Honorable James McGovern, who is Congressman from the 2nd District in Massachusetts. He's a native Worcesterite, grew up on Burncoat Street, and he is passionate about many things, but in particular about hunger. He led the way to make the hunger meeting that's going to be happening at the State House in September was his passion to have this go on. So we'll hear more about that later when he does speak. So thank you both. Thank you for joining us, and we deeply appreciate your support to us for this program.
Thank you, Dr. Young, for your generous introduction, and good morning, everyone. It's a pleasure and a privilege for me to be here to represent the Worcester County Food Bank, and I want to thank Martha Wright for the kind invitation to be part of the Women in Medicine program this morning on food insecurity. I also want to thank the Worcester District Medical Society and Physicians Insurance for the generous donation of $500 to the food bank, which will help us to cover the cost of distributing $2,000 worth of healthy food that has been donated to us. And Martha came out to the food bank last week to do a check presentation and take a photo. So I really appreciate that extra effort that Martha took to get that check to us in advance. My brief remarks this morning focus on 2 areas: the food bank's transition from food provider to also being an anti-hunger advocate, and why public policy has the most impact on solving the problem of hunger, as demonstrated by policy changes made during the pandemic. And I'd like to start first by sharing that as we gather this morning, 20% of households with children in Massachusetts, that is 1 in 5 families, are food insecure. That means these families are worried about how they will access and afford their next meal. For multiracial, Latino, and Black families with children, those numbers rise to 1 in 3 due to racial gaps in wages and wealth. These families could be any one of us, as well as our neighbors, living next door, around the corner, and across town. They are children and senior citizens, college students, parents and grandparents. They are working adults who may be unemployed and underemployed. They are recent immigrants and people with disabilities, veterans, basically people of all backgrounds and life experiences. Some of our neighbors have been struggling for a long while, and the pandemic and the historic inflation have only made their hardship worse. For others, circumstances may have changed just recently, sometimes unexpectedly, resulting in a first visit to a food pantry. Neighbors like Brenda, who told us she is working a second job just to cover the higher cost of food that her family needs. And Maura, who wanted to thank the food bank and the food pantries in Worcester for giving food to her and her friend last spring. She said the food they received saved them because they had run out of food, food stamps, and money. And then as gas prices were rising, people told us they couldn't even afford to drive their cars to a food pantry to get help. Food pantries that had been delivering food during the pandemic have continued that service to help people in those kinds of situations. The food bank first opened in 1982, and like many food banks and food pantries at the time, we were a temporary resource for people experiencing a short-term emergency need for food. Over time, we became an ongoing resource for people experiencing a chronic need for food. Then in 2002, with inspiration from Congressman McGovern, the food bank came to share his conviction that hunger is a solvable problem, as well as his commitment to ending hunger. We had become very good at managing the problem rather than solving it. We recognized that by distributing millions of pounds of healthy food, that we were definitely helping lots of people, but it takes more than donated food to end hunger. To be part of solving the problem, the food bank recognized that we had to engage in advocacy, specifically advocating for community food security initiatives and federal nutrition programs like the Supplemental Nutrition Assistance Program, SNAP, that increases access to healthy food. We also had to advocate for policies that address injustices, such as low wages and systemic racism, that are some of the root causes of hunger. So everything that the food bank does is in collaboration with a broad range of community partners, from local farms and schools to large companies and institutions, and everyone and everything in between. And our advocacy efforts are no different. We embarked on an intentional path to engage with our elected officials on the real solutions to hunger. And we did it one step at a time by joining coalitions and organizations with expertise in advocacy, including Project Bread, a statewide anti-hunger advocacy organization here in Massachusetts, and the Food Research and Action Center based in Washington, D.C. Examples of our collaborative advocacy and its impact over the past 20 years include the following: establishing the Massachusetts Food Policy Council and the Worcester Food Policy Council with support from Congressman McGovern; establishing school gardens and farmers markets in underserved neighborhoods; providing SNAP outreach and application assistance at community health centers; creating the Worcester County Food Bank Fund to End Hunger at the Greater Worcester Community Foundation, which has distributed nearly $1 million in grants to organizations all throughout Worcester County; donating refrigerated trucks to Worcester Public Schools so they can deliver healthy meals during the summer months to kids enjoying the parks, pools, and libraries; establishing the Central Massachusetts SNAP Coalition, and more recently, the City of Worcester Task Force on Food Security. We've engaged in coalitions such as Raise Up Massachusetts, and we succeeded in helping to raise the minimum wage to $15 an hour by 2023. We're involved with the Hunger Free Campus Coalition that is working to end hunger on college campuses, and the Feed Kids Coalition, which this year succeeded in getting the Massachusetts legislature to fund an extension of free school meals for all students this school year. And last but not least, we helped secure $13 million in state funding for the Healthy Incentives Program known as HIP, which enables people to buy more locally grown fruits and vegetables at farmers markets, mobile markets, and farm stands using their SNAP benefits. So when the pandemic hit in March of 2020, the level of collaboration and coordination among Worcester County direct service food providers and anti-hunger advocates was well established and very effective. But in the early months, all of us were still challenged because of the enormity of need created practically overnight having to adapt our services and structures to protect everyone's health, and doing so in a time of great uncertainty. As we all saw, the pandemic exacerbated the existing hunger crisis in this country to levels unseen at any other point in our lifetime. The food bank has never been busier, and since March of 2020, along with our network of food pantries, we have distributed enough food for 15 million meals to support our neighbors in all 60 cities and towns in Worcester County. And from the data that we collect, we know that 33% of the people helped are children under the age of 18, and 14% are seniors age 65 and older. The food bank also collects data on the number of households and people served in Worcester County. And we track the duplicated number, which counts each household and individual every time they are helped within a 12-month period. And during the first year of the pandemic, the food bank and our network of food pantries helped a total of 161,000 families with 444,000 people. That's the largest number of people and families in our 40-year history. Martha, I think, is going to put up a slide on the screen showing that as of February 2020, thank you, just before the pandemic, the food bank and our food pantry partners assisted a little more than 28,000 unique households and upwards of almost 75,000 unique individuals in the previous months. And by unique, we mean the unduplicated number, which counts each household and individual only once in a 12-month period, regardless of how many times they receive help in that time frame. So that was pre-pandemic. Then by February 2021, the first full year of the pandemic, the number of unique households receiving assistance rose to 37,410, a 37% increase. And the number of unique individuals rose to nearly 106,000, a 42% increase. And then by February 2022, the number of unique households and individuals receiving help decreased by 21%. But as you can see, the numbers were still higher than they were before the pandemic. So this is where it becomes important to say that a critical factor behind the decrease in people was the overall impact of multiple actions taken by the federal government, including increasing the SNAP benefit levels, giving people extra SNAP benefits, giving families with school-age children an electronic benefit card that contained the dollar equivalent to what the children would be receiving in terms of school meals. And then schools were also able to provide universal free school meals for every student in their schools. And then last but certainly not least were the monthly child tax credit payments. Those are just to name a few, but these were the ones that were most significant in helping people to be food secure and healthy during the terrible months of the pandemic. The lesson here is that to meet the scale of the hunger crisis that we are facing in Massachusetts and in our country requires big and bold policies, because policy makes the most impact towards solving hunger. We need to regard the decrease that we saw in food insecurity as evidence that policy change matters. Here's another example of the difference in nutritional support from a food bank compared to what a federal program like SNAP can do. For every meal provided by food from a food bank, SNAP provides 9 meals. It was unfortunate that it took the scale of the pandemic hunger crisis to enact some of the policy solutions that Project Bread, the food bank, and many other anti-hunger organizations have been advocating for many years. But now that we have seen the impact, we need to make these policy solutions permanent. Because it's important to note that after February 2022, when we saw that decrease, the decrease actually started to go back up again after some of these programs started to end, such as the monthly child tax credit payments in December of 2021. we saw both the unique and duplicated numbers for households and individuals steadily increase because of the expiration of the child tax credits, but also because we know of inflation and the higher costs for food, gas, and housing. Even more noteworthy is that between March and July 2022, the duplicated numbers for households and individuals have increased to levels higher than those that we saw between March and July 2020 during the pandemic. This indicates that people are seeking help more often now than they did in the first 5 months of the pandemic. So the conversation and meetings like we're having this morning really today coming at a pivotal point as our nation's leaders, spearheaded by Congressman McGovern, are set to convene at the White House Conference on Hunger, Health, and Nutrition on September 28th. And the strategies to address food insecurity are top of mind. Community engagement is also needed, and we're going to really need to step it up if we want to solve hunger along with policy change. Our elected officials and leaders at local, state, and federal levels will play a key role in implementing some of the policies that come out of the White House Conference. And they need to hear from all of us, telling them to keep the focus on solving hunger. How we act now, whether we continue to pursue big, bold, anti-hunger policy solutions, or whether we allow things to go back to normal, is critical to the future for so many of our neighbors. Thank you.
Well, first of all, let me thank the Worcester District Medical Society's Women's Caucus for the invitation. Thank Lynda Young for her kind words, and thank Jean McMurray for her presentation. I think she has outlined the realities of hunger in our community. And let me begin by saying we have a hunger problem in this country, and we have had a hunger problem long before the pandemic. It was exacerbated during the pandemic, but it was there before, and we have not responded to it adequately. We did step up during the pandemic, but a lot of the emergency funds that Jean referred to will be expiring. And my fear is that we will do what we usually do in this country when we have big problems, is we talk about them for a while, and then we forget about them and move on to something else. Before the pandemic, I think the figure was 38 million people in this country who didn't know where the next meal was going to come from. 38 million. That went up higher during the pandemic. It's come down a little bit, but it's still tens of millions of people. Children, working people, senior citizens, immigrant families. I mean, the face of hunger in this country defies any stereotype. It's not just those who are unhoused or without jobs. It's working families. People who are working full time and who cannot afford to put food on the table for their families, and still pay the rent, and still pay all the utility bills, and still pay gas bills and everything else. So this is a big problem. And I tell people all the time that hunger is a political condition. And by that I mean is we have the food here, and we have the resources, and we have the infrastructure, and we have everything you need, but we have lacked the political will. And so for whatever reason, we haven't addressed it in a holistic way. We have managed it. We have programs to kind of, keep it in check a little bit, but we have not had a holistic approach to trying to end it once and for all. And one of the problems with government, we begin with Congress, is that the way it's set up, it's not easy to solve problems. And by that, I mean, on this issue here, when we talk about hunger, if you want to talk about SNAP, the Supplemental Nutrition Appropriations for the Emergency Food Program, you go to the Agriculture Committee. That's who has jurisdiction over SNAP. If you want to talk about school meals, you have to go to the Education and Labor Committee because they have jurisdiction on that. If you want to talk about food as medicine, you got to go to the Energy and Commerce Committee or maybe the Ways and Means Committee. And if the Agriculture Committee focuses on food as medicine, then Energy and Commerce and Ways and Means get pissed off. And so everybody has their little jurisdictional kind of walls that they build. And the same in the executive branch. I mean, we have different departments that do different things. And they don't all sit together and say, okay, today is hunger. All right. What can USDA put on the table? What can the Department of Transportation put on the table? What can HHS put on the table? What can what can the Department of Defense put on the table? And I would argue that is what is needed if we're going to solve this problem. And food banks, are a godsend, but they're not the answer at the end of the day. I mean, we need to look at our systems differently, and so I've been advocating since President Obama was president that the White House do a White House conference on hunger, nutrition, and health. The last time a conference like that happened in the White House was in 1969. That was the year we landed somebody on the moon. And in that conference, the WIC program emerged, the Women's, Infants, and Children's Program. And that conference, kind of the modern day food stamp program, emerged. More attention on child nutrition, labeling, on products, so people could make decisions as to what they were buying was actually good for them or not good for them. So good things came out of that conference. One of the things, that I would say was missing in that conference was that most of the people who were there or who had speaking roles looked like me. And it didn't, I don't think, adequately represent the diversity and the complexity of our nation. But nonetheless, it was a historic conference. And it didn't reflect enough people with lived experiences, because I have lots of ideas, but sometimes my ideas sound good in my mind, but in reality, they don't fit the reality. And so you need to talk to people who are on the ground, who have lived experiences. So we were not able to get President Obama to do it, although the First Lady did focus a lot on child nutrition, and we increased nutritional standards in school meals. And she was a big proponent of exercise, which is a good thing, right? But it fell short of kind of what I believe needed to be done. And so anyway, then we had 4 years of, I don't want to talk about it. And then now we have a new administration. And as soon as the election was over with, I sent the president-elect a letter and talked to him and talked to his key aides, and then sent another letter with every chair of every committee in the House, and then sent another letter with the Speaker of the House saying, you got to do this. You got to do this. This has to be a priority. And then we had back and forth, and they said, well, there'll be high expectations if we do it. Absolutely, there will be. We want you to be big and bold, and if it's just a press conference, we will be very, very disappointed, and we will yell at you if you do it badly. And it's, well, okay, well, we get it. Well, we need money. Well, I never heard of a White House ever going to Congress and we need money for a White House conference, because they get lots of money. But nonetheless, thankfully, I'm on the House Rules Committee, and we can attach things to things. And we put $2.5 million in, so that's gone. Then they agreed to do it, and it's going to happen on September 28th, and it's going to bring all kinds of people together, and hopefully it will result in outlining kind of not only the challenges but the goals that we all need to reach. And when I talk about systems need to change, I'm talking about our educational system. I'm talking about our medical system. I mean, I'll give you the on schools. One is, Gene is absolutely right. We ought to have universal free meals for every kid in every school in this country. California just passed that. Maine did. Vermont did. Massachusetts legislature extended it for another year. It ought to be permanent. Every kid that goes to school ought to have at least 2 good, nutritious meals. So let's hope we can kind of this conference could be wind at the backs of those who want to make this a national and permanent effort. Secondly, I don't know when it became okay to not teach kids in school about agriculture or about nutrition or even how to prepare food. Because, we have, I was in Harlem a couple of weeks ago. I visited a program called Harlem Grown. It's an incredible program. And they basically have taken some vacant lots in Harlem, and they have decided to grow fresh produce there. And they have greenhouses, they have all kinds of stuff. And so the guy who initiated the program was telling me, this was all great. And then he said, I was giving the kids in the local schools, fresh produce to bring home, arugula, kale, all kinds of really neat greens and stuff that are all very good for you. And he says, and then I said to the kids, okay, what happened? Did your family all enjoy the food? And they said, well, they threw it away, most of it. I said, why did you throw it away? Well, they weren't raised on arugula. They don't know what to do with kale and some of the other things. So it occurred to this guy that, look, the issue is not just I need to give you food or good food. You need to know that this is good food. And so he began a partnership with some of the schools where the kids participate in planting the vegetables. They help garden. He does some cooking classes, teaches them nutrition, and then he gives them they have this free kind of farmers market, and they bring the stuff home. Anyway, it is hugely successful now, and everybody's clamoring for what they grow. The other thing he did is he said, this is a community project. It's all community building. It needs to be sustainable. We need to make sure that nobody vandalizes any of these gardens. So they hired local people who live in that neighborhood to oversee all of this. So now when anybody kind of gets to the gate, all these lights go on, everybody looks, who's trying to get into the garden? So anyway, it's a successful model. And they teach nutrition. They teach nutrition lessons, not necessarily as a separate course, but through math and science. There are measurements involved, and there are all kinds of things that can apply math science. So it is a good model. Every school ought to have a garden. Every school ought to have a greenhouse. Every school ought to teach kids how to cook, because it is incredibly important if we're talking about, keeping kids healthy. Secondly, our medical system. I got to tell you, if you're going to design a medical system from scratch and not have a greater focus on nutrition, we got that system right now where nutrition essentially is divorced from our healthcare system and from many of our hospitals. Some of the worst food in the world that I have ever had, that I think is the reason why I'm on Lipitor, is because of the food I've eaten in hospital cafeterias. And you talk to the patients, and you give them, quote, healthy food when they're sick, but sometimes it tastes like cardboard. And so they don't always eat it. And then there is no follow-up when people go home in terms of medically tailored meals that could follow them to help them get the nutrition they need to recover from whatever surgery or treatments they have. And we have to change that. You should not be able to become a doctor unless you've taken a course on nutrition. And, we have been trying very hard to try to get nutrition more prominent in medical education. And I met with the heads of a whole bunch of prominent medical schools, and I asked, why don't you? Why isn't it like a separate course on nutrition? Why is it just covered generally in some other course? And the answer I got was a stupid answer. The answer I got was because, quite frankly, there are no questions on the boards on nutrition. I'm like, so it's as simple as you teach the test, and you've decided that since there's no questions on nutrition on the test, that it's not important. Well, we all know it's important, but we got to get these students to pass the medical boards. That has to change. That has to change. New doctors also have to be able to know what hunger looks like in America. So it's not starvation like you see in sub-Saharan Africa. Hunger in this country can manifest itself through obesity. It can manifest itself through, kids, having pains in their stomach and, which are hunger pains, but people have to be trained to know to ask about that. Our hospitals ought to be food pantries as well. Boston Medical Center, I think, is an incredible model. I have been knocking my head against the wall trying to get every hospital in Massachusetts to do what they're doing. And there's always 1,000 excuses about space and this and that. But I'm like, they began by emptying a linen closet and making that a food pantry. The doctor at Boston Medical Center, Dr. Deb Franks, was a champion of this because of the high infant mortality rate. Babies were dying, and it was tied directly to lack of nutrition. So now if you go to Boston Medical Center, they don't have a food pantry. They're into food prescriptions. They have a garden on their roof. I even got Boston Medical Center honey when I was there because they have a bee farm on the roof of Boston Medical Center. But they're linking nutrition directly into the treatment of their patients. I mean, if you have diabetes, it is not just you have to take the insulin. You also have to, make sure that your diet is something that will help you not get sicker, right? And so they understand that they're linked together. And so we are hoping that this conference is going to focus significantly on this issue of food as medicine. Because if you're going to combat hunger, right, hospitals play a role, doctors play a role. What do you do when somebody comes to you and doesn't, that they don't have enough to eat? We have to have a response that is more than just, find your local food bank when they may not even know where the local food bank is. When somebody says that you need to change your diet, that has to be more of a focus. We have to talk to insurance companies about better reimbursement for medical systems that actually embrace nutrition as a central fact in treatment. I was in California, I chair the rules committee, and the great thing about the rules committee is we have no jurisdictional constraints. We can do whatever the hell we want to do. So I have, for the last 2 years, been traveling around the country, basically doing hearings on food as medicine, on the transportation, how it fits into hunger, challenges on tribal communities. I mean, you name it. Every hunger on college campuses, the whole thing. But I was in California a few weeks ago. Went to University of Cal Davis Medical Center. They hired a chef who designs meals for patients and for people who work and visit the hospital, relying on local produce, really innovative recipes, helping people appreciate different tastes without heavy reliance on sodium. And it's so good that patients who leave the hospital ask for recipes. And they now have a recipe book to go with them. They have a CSA in the hospital for people who work there and for patients and for their families. You can pick it up and it has a recipe on what you can do with it, because not everybody knows what to do with the fresh produce that we oftentimes give them. Anyway, long story short, it costs them a little bit more, but the results, are such that it's saving them money. So oftentimes you dismiss somebody from a hospital. Oftentimes one of the reasons they go back prematurely or unnecessarily is because of lack of nutrition. And so they're trying to address that. And the issue is, can CMS, can Medicare, for example, can they provide additional reimbursements as incentives to get our medical system to embrace some of this stuff more? Can insurance companies do the same thing? And, and I think a case can be made to insurance companies. Again, I know you don't care about patients, but you care about the bottom line. If you care about the bottom line, you ought to be with us on this because you'll save money. I'll leave you with this. John Hancock Life Insurance in Massachusetts has this program where they provide people who are their clients a little card. It's good at a number of supermarkets. And you go in when you buy your groceries, you give it to the checkout person, and it goes into, don't ask me to explain technology, but it goes into a file, and it kind of documents the stuff that you're buying. And if you buy things that are to show that you're having a decent diet, you get a rebate at the end of the year, actually a significant rebate. So it's not just $10, it's more than that. And I remember I met with the head of the company, and I said, geez, this is a good thing, and thank you. It's going to help a lot of people. He said, well, I'm glad it's going to help a lot of people. He says, but I got to be honest with you, that's not really why we're doing it. We're doing it because if you live longer, you're going to pay us more. We're going to make more money off of you. So we don't want you to die at 30 or 40 or 50. We'd like you to live to 100. And so we're making a calculated decision that this incentive will reap us more profits at the end of the day. Fabulous. Very rarely do corporate interest and public interest kind of meet. We may be at a place here where, when it comes to food as medicine and addressing the issues of food insecurity, that they may meet, and we may be able to find common ground. So we're hoping that this conference will kind of raise some of these issues, will set a roadmap forward as to what we need to do. But look, we can do this. This is a solvable problem, as Gene said, that we can do this. And but the one thing we have to grapple with, at least up front, is that one of the biggest hurdles to change is that you get systems that have been doing the same thing forever. And even, if they know it's the right thing to change, and even if they know they can save money if they change, sometimes it's just difficult to get people to do something different. And we have this conference can lead to a transformational moment. But we all have to push, and we have to push our local institutions to do better. I mean, there's some good things going on, little bits and pieces, and there's some good models in the state that are happening. But we need to scale this up, and we need to scale it up, more significantly. And the final thing I'm going to say is, living in Worcester, one of the great things about Worcester is that this is an incredibly diverse community. I mean, every year we have a new group of immigrants who come in that, enhance our culture and make this place even more fabulous, right? We also have to pay attention to the fact that we're a city of many cultures. And so what is nutritious in my mind and what is food that you should eat in my mind may not be the food that kind of fits what somebody else might want. So we have to also be sensitive to the cultural appropriateness of what we provide people. But in any event, I appreciate the fact that you're talking about all this stuff. Love the work that Gene McMurray and the Food Bank continue to do, and I look forward to working with all of you. So let me end there.
So thank you so much, Jim. You made some very good points, and they were very well taken. You mentioned about the system changes that need to happen, and that really not a whole lot has happened in the over these ensuing years. And it reminds me of a quote that I think was attributed to Einstein: the definition of insanity is doing the same thing over and over again and expecting a change, or a different outcome. So I think that change is good, and that we're going to need to have something done in order to help in order to help this food insecurity problem. So I'm going to open this up to questions. And what I'd like to have you do is, if you could please use your raise hand icon that's at the bottom of your screen. And if you take a look in chat, there are some nice links that will give you some more information that was mentioned during the previous two speakers. So one of the things that I just wanted to mention to you, Jim, is there is a program But before I get to that, let me just mention about the food is medicine. And I was talking to your staff as we were preparing for this meeting today. And I said to them, I remember Jim working on this for a long time, and it's finally happening. And your staff told me that indeed it was introduced in 2009. So it took a while, but there is some change here. And we are going to have this White House conference in September. So that's very exciting. So let me get back to what I wanted to ask you about. If either you, Jean, or you, Jim, could comment on a service that is available in Worcester. It started in Boston, but it's community servings. And this is something that I think a lot of us would like to hear about because it could be a great service for our patients.
Yeah, well, I'll me begin. Jean can comment. Community servings is incredible. David Waters is a good friend, and I've been there a million times. What we need to do is make sure that there's coverage for they're medically tailored meals. So you go in, let's say you've had chemotherapy, but you're a diabetic or whatever, and you may live alone. You go home. This is a service that provides you meals that are nutritious, that are specific to your needs, so that that they no matter what ails you, these meals will be designed specifically to help you get well. And they are done in a way where they smell and taste like the food your grandmother used to make, which is really key, right? I mean, I tell people all the time when we talk about, nutritious food, sometimes people kind of say, oh yeah, well, it doesn't taste good. No, they make it taste good. So people eat it. And again, the result of it is that they're less likely to be readmitted prematurely to a hospital. They're more likely to get better. They're more likely to get stronger. And what we need to do is we need to make sure that, like, Medicare should cover that, right? Insurance companies should cover that. I have a bill that I hope we're going to vote on in the next couple of weeks that will provide a pilot that will have Medicare reimburse hospitals, and for embracing that kind of a service. But those are the things we ought to be thinking about. And community servings is here, but it's not into our system, and it ought to be easy. And again, it might be somebody who's older who needs it, or might be a young kid. In the Matthew Shepard Act, we provided medically tailored meals early on for people battling with HIV/AIDS. It was an important service to help people, get stronger. And it worked then, it works now, but we need our systems to embrace it.
So I see that there's a hand raised from Hugh Taylor. Hugh, thank you. Welcome to Worcester District.
Thanks very much. I'm an interloper from Essex County up here, but thanks very much for that presentation. I just want to say, Jim McGovern, you had talked about getting hospitals involved with, approach to food insecurity. So I was at the board of my hospital yesterday talking about the community needs assessment. And I'm sure you know this, but all hospitals in the country are now required to conduct a community needs assessment every 3 years to look at what's going on in the communities. And I was frankly surprised, because I live in what I thought was a fairly well-off area. But, in the towns around me, roughly a third of people reported that they were food insecure. And, so it's a lot. And I think that there's an opportunity for the hospitals, as ours is doing, to get involved with addressing that. So that's one thing that you need to keep in mind as we talk about how to craft a nationwide approach to this problem. Thanks.
No, I'm well aware of that. I'm well aware of that, and the community needs assessment. I should just tell you that this is a little commercial. Came out of the Affordable Care Act. That was something that was in the Affordable Care Act. It has led to some great partnerships here in Massachusetts and across the country. But look, and let me just say this: I think if you're the head of a hospital, I mean, obviously you care about the patients, right? but you also have to worry about the bottom line too, right? You have to worry about, I mean, where's the money coming from? And can we afford to do this, right? So the deal is, one of the actions ought to be conversations with insurance companies, as well as engaging with, the federal government about, helping us get appropriate reimbursement if we're going to, ratchet this up. Again, you should Google this UCal Davis Medical Center. It made me want to get sick. I wanted to go into the hospital to be able to experience the incredible cuisine. But, it also shows with a little imagination, you can do amazing things. And it's not just about the patients. It's about the doctors. It's about the nurses. It's about the people, the support staff at hospitals, making sure they all have access to good, nutritious food that is affordable, that is not, out of people's price ranges. I mean, that I think is, I always tell people, what I've learned is I don't think we need to reinvent the wheel, because the wheel has been invented in a whole bunch of places. It's like, all right, we know what we got to take this wheel and attach it to the right vehicle so we can move forward, right? And, one of the things I want this White House conference to do, and again, not just in the area of food as medicine, I mentioned this program called Harlem Grown. There's these incredible food rescue operations that are springing up all across the country, working with our farmers. There's 1,000 things we can do. But I think if we can elevate what is going on that is working, and then we can figure out how can we be wind at the backs of these efforts. And in the case of, hospital, insurance companies have to come to the table and play, right? And CMS has to understand that, it is important for them to provide the appropriate reimbursement so everybody can step it up.
Yes, Lorraine, you're next. You have a question?
Yes, hi, Congressman. It's Lorraine Schratz, and I apologize that my video is not working. We've talked before in the past. I'm a pediatric cardiologist at Mass General Hospital and run a program which is called Raising Healthy Hearts, which is specifically geared at children, adolescents, and their families for starting their healthy lifestyle habits so that they can avoid heart disease later on in life. And I just wanted to say thank you, first of all, for the work you're doing. And yes, 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 about insurance reimbursement, because on one day as a pediatric cardiologist, I can get paid pretty well. And then the next day when I'm giving my expertise for healthy lifestyle so people don't need a cardiologist when they're an adult, I don't get paid at all. And I rely on philanthropy to run my clinic. And that makes absolutely no sense. So 100%, thank you. My question is, how can we help as advocates, as physicians, members of the MMS? How can we help you move this forward when in the reality is we're putting out fires every day and just trying to take care of the patients that come before us, but we're all very interested. So what can we do?
Well, thank you. I appreciate it. Thank you for what you're doing. Let me just say a couple of things. First, on philanthropy. Philanthropy is wonderful, right? But not everybody can get access to philanthropy. If you're in like this group I mentioned, Harlem Grown, it's all philanthropy. But they're in New York City. There's lots of rich people in New York City. You're in Mitchell, South Dakota. Where's the philanthropy, right? I mean, if you're in, and it's hard to get philanthropy in Worcester, as opposed to Boston, right? So, philanthropy. We want to encourage philanthropists to give and help, but they can't do it alone. You can't philanthropy your way out of this hunger and nutrition insecurity problem. So we need systematic change. The other thing is, look, just like on the universal free school meals issue, I would like the federal government to do something right away to make that a reality. It's probably not going to happen unless we win a few more seats in November. But we ought to be pushing this stuff on the state level, and we ought to be pushing nutrition education on the state level. We have we're about to change administrations in Massachusetts. We're going to have a new governor, new lieutenant governor, new everybody, right? And I think this is an opportunity for us to start thinking, okay, as we try to move things on the national level, what is it that we want our state to be a model on? How do we change our school curriculum? How do we provide funding for school gardens? And I think here, because we still have winters, climate change hasn't taken that away totally yet, but we ought to be talking about greenhouses or hydroponics in the classroom. This ought to be part of the curriculum. We have schools that still don't have kitchens or refrigeration. So if I got a farm that wanted to donate peaches to some of the schools in my district, a lot of them could take them. Some of them say, well, peaches, I can't store them very long without refrigeration, so I can't take all of them, right? So we ought to understand there's an infrastructure component to this. And then on the medical stuff, I mean, look, this ought to be front and center. The thing about this country is, if you have something really wrong with you and you need a brain surgery or heart surgery or what you name it, I mean, there's no better place in the world to be than here and in Massachusetts, right? But we're not very good at preventing you from getting that, right? And so, and that requires some new thinking here. So I would say that, we ought to stay in touch and talk about, we have an opportunity with a new administration coming into Massachusetts. What is it that we should be pushing on a statewide level that might be a model on the national level? And then let's see what happens at this conference. I mean, if there are some things that come out of this conference, that they're going to try to move at a national level, then we should come back and figure out ways that you can use your influence, either friends in other states or through associations that you're part of in other states, to get them to be wind at the backs of these efforts.
So Marie, you have a question? Go ahead, please. And I see Nandana, you also have a question. So go ahead.
Great. The other group, that I think about are the farmers. And, I know Congressman McGovern, you just did a farm tour recently, in Massachusetts. And, especially small farmers, I think really struggle just to make ends meet. I know my own daughter is a farmer in rural New York State and makes so little money that she is on Medicaid, but works probably, 70 hours a week in the summer at least. So, that's the other group that I think we need to be partnering with, in all of our institutions.
If I could just add to that, thank you so much. You're so right. I think when the Congressman talks about changing our systems, we should be looking at the community food system and everybody that's involved. And that starts with the farmers who grow healthy food. And how can that be, support them to maintain their livelihood while providing it? And that's a great segue back to community servings, because some of you may be aware of the wonderful Community Harvest Project farm in North Grafton, and they also have an apple orchard in Harvard. And the food bank is very blessed to be a recipient from that wonderful locally grown fresh fruits and vegetables, but they also donate to community servings. So there's the model, locally grown food going into medically tailored and prepared meals. It's just a win-win across everything.
Yeah. And the other thing is, a lot of people don't know this, but about 40% of what we grow in this country, we discard. Wow. And it's really, my grandmother used to say, if you waste food, it's a sin. So we're all going to hell under her definition. But the deal is, we ought to increase tax credits and incentives for farmers who donate their food to at a higher rate than they get now, but to groups like community service or to food banks, or to organizations that rescue food. Because again, I mean, buying let me tell you, buying a tomato locally grown in Massachusetts, as opposed to buying a tomato that comes to you from California. I mean, I know what that tomato from California goes through, the spraying, the refrigeration, this and that, and the wax, the coloring, the whole thing. The tomato that you have in the winter here is a traumatized tomato, right? So supporting our local farmers needs to be at the top of the list. And but they've been, by the way, the farmers have been amazing, and Jean will tell you in this whole effort to combat hunger. But we need to make sure that they don't become hungry too.
Right. Yeah, we're very focused on supporting the local farms. We actually receive a grant from the state of Massachusetts, and we work with local farmers where we pay them, and they give us the food. So we're very happy to, make those connections, because it's that we're all better off when our local farms are healthy and sustainable.
And Mandana, you have another question. Please go ahead.
Thank you so much for all the work you're doing. This is so incredible to hear you touch upon every single part of nutrition. And one thing I'd like to say is that you mentioned Worcester, that it's hard to do philanthropy in Worcester. But for about 5 years, we ran a program at St. Vincent Hospital where, I would show up every morning or every Saturday morning and volunteer the time to teach patients nutrition and to simply spend an hour just walking with them. And I would actually cook with them. I would bring in healthy snacks and be partnered with different organizations across, Massachusetts, including physical therapy and chefs and nutritionists. And it was a beautiful model. But then came COVID and the program stopped. But the point I'm trying to get to is that if physicians know how to eat, and then they know how to teach. As you mentioned, that a lot of times in medical school, that whole emphasis on nutrition is simply not there. So even at a school, if we can introduce nutrition as a science that is taught to the medical students, when I'm at St. Anne's, so many times I will ask the patients, why is it that your A1C is over 10? And they simply don't know how to eat. And when I ask the medical students to get that history, they're completely clueless. So that is a part of the curriculum that we have to develop. And as physicians, we have to learn how to eat and how to teach that, so that when we translate that into the medical care of the patient, it's not just the medicine, but it's the comprehensive care of the patient that we are providing.
Well, thank you. And let me just say, we, I had the Secretary of Health and Human Services, Javier Becerra. We were in Leominster a week ago, and we talked at length about this. And I do think that what will come out of this conference is a strategy to make nutrition education more prominent in a medical education. So I think that will be something that will emerge from this. And again, cooking is a skill. And by the way, this is a skill that all of us can utilize, right? I mean, the nutrition challenges are not just amongst those who are economically challenged. It's everybody, right? And one of the things that you need to understand is that in this country, for whatever reason, we threw nutrition out the window. I mean, if you buy a bag of potato chips in the United States, right, as opposed to a bag of potato chips in Europe, there is less sodium in the chips that you buy in Europe than you do here. Like, why do we tolerate that? I mean, and we all know that, salt, among other things, can be a little bit addictive, right? I mean, it makes you want to have more chips. And, but it's not good for us, right? And again, I grew up in a generation, the Tang generation, where there was no attention to nutrition. I mean, my mother, I love her, but I mean, I think we had Twinkies and Coke for breakfast. So it's like, and it's really hard as you get older to change your habits, right? That's why early education is important. But but you're never too old to learn how to cook, and you're never too old to to try new things. And, and I've seen firsthand models all across this country where people are being taught new skills and they're utilizing them and their health results improve. I mean, it's dramatic. I mean, the stories you hear. And I'll leave you this one thing. We did a listening session in preparation for this hunger conference in New York City. The new mayor of New York, Eric Adams, hosted it, and he invited me to speak at it. And I didn't know this about him before, but he had diabetes so bad that his doctor said, you're going to lose your eyesight. You're probably going to have, at least a number of your toes, if not your foot, amputated. I mean, you have no future. I mean, basically. And then he changed his lifestyle, changed his diet. And now he looks like, he can do a, Fitness America commercial. But the bottom line is his health, has improved like miraculously. Now, here's the other challenge we have, and we talk about nutrition, is that, people do not like to be force-fed things. People do not want to, don't want to be told you can't have a hamburger. People don't want to be told you got to be a vegan for the rest of your life, or you can only live on a plant-based diet. I get it. So, some people you can, some people you can't. So we have to talk about this way to make people feel comfortable in working with you to get to a point where they're on it, they have a diet that actually is good for them. And you can do that. You can do that. You don't have to go one extreme to the other like Mayor Adams did. There are ways to get to where we want to go. But I really do believe that we have to focus on young kids. It begins in the schools. But in any event, we will stay in touch. And I will funnel through Lynda and others on this call some of the stuff that comes out of this conference, and Jean will stay in touch with you as well about some of the local initiatives. But I'm optimistic that we can do something really important in the coming months. So this conference is not the end; it's the beginning of a strategy and implementation. So we'll stay in touch.
Are there any other questions at all? I think that one of the things that in the chat that's there, which a few people have commented on, is that people need to learn how to cook. Jim made a point about how, if you go to the gardens that are out there and you're picking arugula and you have no idea what it is, you're going to throw it away because you don't know what to do with it. So I know, Jean, the Worcester County Food Bank does offer programs and classes in cooking, and so that's a really good help, I would think. Anything else at all?
And let me thank Jean, by the way, for there's they do a lot of support work to help people with recipes and how to prepare things. And I got to tell you, the other group of people that we need to bring in that even should be brought into the healthcare field are our chefs. I mean, our chefs, have been stepping up on this area, and good food is great, but good food that doesn't taste good, no one's going to eat. So, it's important. And knowing how to cook is important too, because you can stretch your dollars. And there's less preservatives and that as opposed to prepared food. Having said that, we have people living in the city of Worcester who live in not people who are unhoused, but people who live in apartments that do not have refrigeration or do not have working kitchens.
Right.
And so we also have to understand that we need to make sure that people have access to prepared meals. And then the final thing, I just want to make a point, this is about community building. It doesn't work if it's not about community building. And, whether it's in our schools or Meals on Wheels or other stuff, we ought to utilize the talent of our local restaurants. And rather than getting meals shipped in from halfway across the country, we ought to contract out with our local businesses here and have them prepare the meal. It's fresher, less preservatives will be in the food, and it also helps them as well. There's an economic development component to it.
Thanks to both Jean and Jim. This was really a wonderful program. And I think we learned a lot. We learned a lot about what we could do. We learned a lot about what needs to be done. And we all appreciate the time and the effort that goes into a very big problem with food insecurity. So this next picture that you're seeing here now is a picture that was taken at the Worcester County Food Bank. It's a picture of Martha Wright, our executive director, and she's giving a check to Jean. And this is a donation from the Worcester district, and also was matched by physician insurance. So thank you so much. to the Worcester District and to Physician Insurance for their generosity to the food bank. Also, you'll notice on this slide, there is a little Starbucks coffee in the corner. So for those of you who participated in this meeting today, you will receive via email a gift card for a cup of coffee at Starbucks. So enjoy your cup of coffee on us. Also, thank you again to Physician Insurance for providing this nice little perk. So this was a wonderful, wonderful session. I so enjoyed it. I'm so glad so many people were able to join us. We know that it's a multi-layer problem to provide food for people, and we need to look and think about how we can help change things that we heard that need to be changed from Jean and from Jim. And as I say, it's given us a lot of food for thought. So the last slide here is the website where you can donate to the Worcester County Food Bank, should you wish. It's in the chat also, if you wish to reference that. And again, we'll thank you for generosity and thank you for joining us today.